Good morning, everyone. I'm Dr. Ding from China. It's a great honor to stand here to share my case about anterior aesthetic based on the FP1 concept. Every girl wants a good smile and a confident smile, but sometimes with a taste problem, they can't smile with confidence. So that's what we need to do. This patient is a 32-year-old female. She visits to our clinic. The chief complaint is that she wants to improve the appearance of the front teeth. Let's see the front view. This crown was made 5 years ago, but 1 week ago, she got an accident by an e-bike, and this crown fell off. So I bound it temporarily with the 17. We can see the gingival margin was not symmetrical on left and right side. And this static occlusion is stable on forward, right, and left side. And this is facial smile of the patient. Every anterior prosthetic we will begin from the facial, not just the teeth. And also we need to analyze the smile line of the patient. This patient is a medium smile line and the midline with a little deviation. And we will remove this crown. We can see the fracture root and the gingival contour with a little depression. And then we take an X-ray. We can see that this root with a canal treatment, but the apic side with a little inflammation. So we need to consider the smile line, the tooth proportion, the incisal profile. So we did a detailed smile design for the patient. And on the right side, we need the long crown lessening, and also need to manage the papilla. So we use the software of the smile cloud to design the virtual smile of the patient. The tooth proportion, the length, the smile line, incisal profile, and we can see the virtual effect after we design. But before the initial treatment, we need to do the risk assessment by SAC. We need to consider the aesthetic effect, surgical effect, the prosthetic effect, and we can see this patient with so many high-risk effects of this surgery. So the diagnosis, the 12, 11, 22 with retained root, 21 missing, and 13 with retained crown. So we make a treatment planning for this patient. Combined with the thinking and design concept of the final dentition, comprehensive consideration of anterior teeth, distribution, and global aesthetic design factors. So extract the root of 12, 11, 22 with the immediate implant and integration of soft tissue augmentation. And tooth 13 receive fiber post and crown restoration. And while tooth 23 is restored with a veneer. The selection of implant support fixture bridge on 12 to 22, we have two choices. One is standard abutment, another is a multi-unit abutment. For the paper, in the research, we can see the standard abutment will be cause the residual cementing. Maybe in the future, will be cause the peri-implant disease. So we choose a multi-unit abutment and follow the concept of the FP1 because we need a better aesthetic result. So based on the treatment planning, we make a timeline for the patient. The initial, the data collection, and the first implant surgery, preventional bridge, and 2 months soft tissue augmentation. The last 1 month, we did the second preventional bridge, and the final, we do the crown and veneers preparation for the final restoration. So the first, we use ExoCAD to design the mock-up. based on the profile and smell line. And also with the software about DTX to design the patient of the implant. The music can a little high. Because the thickness of the bone is so limited, so we need to place implant precisely. So the first stage is implant surgery and the prevention bridge. Extract the root and place the implant. And with the broad diamond implant, 3.3, and we use different multi-unit abutment, 17, 0, 13 degrees. And the jumping space, we use stick bond to fill it. And take an X-ray to check the patient is well. And near the chair, we do the prevention bridge and use the rubber band to protect the socket. And this is the P1 prevention bridge. And at the right central incisor, we do the turn technique and use CTG to do the soft tissue augmentation. And this is after suture. And take an X-ray to check the abutment was well seated. After we place implant, we also take an oral scan because we need a printed provisional bridge because it is much more smooth than we did it near the chair. And this is a printed provisional bridge. And 2 months follow-up, the soft tissue augmentation. And this is 2 months follow-up. And soft tissue was healing well, but counter with a little depression. So we use CTG to do the soft tissue augmentation on both sides. On the right canal, we did the crown lengthening because we need to balance the gingival margin at both sides. And this is a protocol with surgery for soft tissue augmentation, the crown lengthening, and we use a micro blade to do the tunnel technician. The soft tissue augmentation, we need to consider the contour, the papilla, and the curvature. This is the after suture. And on the left side with the double sling suture. And the stage 3, 2 months follow-up, we did a second prevention bridge. The soft tissue healing well. And we use the commands to the oral scan. The placing of the implant. And also record the temporomandibular motion trajectory because we want the occlusion was much more stable. And this is second prevention bridge. At this site, we need to do the pontic design because we need an ideal contour and aesthetic result. There's a prosthetic biologic wax on the stable pontic site. On the maxilla, it's about the void is about 2.332. And the stage 4, 1 month follow-up, we did the final restoration. And we prepare the veneers and the crown under the microscope and polish it. And with the oral scan for the emerging profile, the veneers are like down. The pontic, the crown, and the veneers. And we send this data to the lab and the lab work for ceramic build based on the ExoCAD design. And this is the final restoration and on an art view, because we need a beautiful aesthetic result. And with the cornea titanium support FP1, this is the bridge, we use the cornea, and the abutment connect, we use the titanium. And this is the finished result. The static occlusion on forward, left, and right side. And also, we need to check the occlusal guidance. This smile of the patient. Also, we need to check the abutment with the retaining screw as well. Liver situation, 8 to 13 months follow-up. 8 months, 13 months. This is the smile of the patient. And also this is the dynamic occlusion for the forward, right, and left side. It was stable and fluent, and this is final smile of the patient. And we can see the change before and after on anterior occlusion view. And also we can see the video, the smile before and after. She with a big smile and with confidence, and we can see a ray of light illuminate the heart and lighting up her eyes. We need to embrace the concept of holistic dentistry, comprehensive the consideration aesthetic smile line, gingival margin, curvature, soft tissue contour, and the restoration retaining method, combined with the detailed design, precise implantation, and precise soft tissue augmentation. Only then we can achieve a long-term and stable aesthetic result. For the patient, we changed not just the teeth, but the smile and the confidence. So this is a reference. Thank you so much. This is my presentation.